So topic 2 is our last topic, addressing basic research questions that anticipate clinical needs. Sharon Plon is our moderator, and we have as panelists Howard Chang, Stephen Chanik, and Howard Jacob.
So our topic was much more limited, but you'll see we kind of went big anyway compared to the prior topic. We're also the last topic, so just want to remind people during the discussion, this is one of your last chances to say, did we miss your favorite thing? I did just want to start out with a comment I made earlier. There is a large, robust division of genomic medicine, and this meeting was not really focused on genetic medicine. This topic is really what's the basic research questions to anticipate clinical needs or needs in genomic medicine. So we tried, as you'll see from the comments, to give that perspective and not propose specific necessarily clinical projects. The other thing we're going to start out with is just a slight pause. We've changed the order for this reason. Eric Green started out the meeting by saying that NHGRI is only doing 15% of the human genome research, and so since Stephen Chanik, who is based at NCI, is on our panel, Stephen's just going to start out with a couple of slides that highlight just an example of NCI as one of the institutes that's really generating large genomic databases, to give people a sense of some of the data that's existing that could be used for projects proposed by this strategic plan. And then he will then switch to talking about his proposals for NHGRI. Then we'll go to Howard Chang and Howard Jacob. I think our panel was particularly interesting in that we had an intramural scientist, an academic scientist from Stanford, and then Howard, who is now at large pharmaceutical companies. So we also had different perspectives on where research might be useful. So with that, I'm just going to have each of them go through their slides. So as I said, the first part is just going to be examples of genomic data. So